Hi, welcome back to Merely Your Guide. I'm Margaret Martin. As you are well aware, the plank and the side plank poses have become really popular and an integral part of yoga classes and Pilates and boot camps. We need to spend, a specific time, to assess individuals to ensure that they're actually, ready to do the level of planks and side planks that we feel that we're going to integrate into, a session for them. And so the planks and side plank poses are wonderful, wonderful exercises when done properly. They strengthen the core and they do so much more. When looking for one or two exercises that allow you to target not just postural muscles, but the neck extensors and the side flexors and shoulder stabilizers and all the way down through the core into the hip and ankle, the plank and side plank poses are really a perfect prescription for that. When individuals are first exposed to them, unfortunately they're often exposed to the plank and side plank at a very high level. They'll see them on fitness websites and they'll see them in print publications. They might try them and but when they try them, they'll, as a general rule, fail. Either fail in form or fail in the sense that they feel strain where they shouldn't feel strain. And I frequently find that fitness instructors and personal trainers often overlook the natural progression from a beginner level through to an active level to an advanced level plank and side plank. And I wish really that this information had been given to me years ago when trying to integrate it with clients. And it was only through a process of exploration and wanting to provide all my clients, regardless of their level of fitness, with the opportunity to gain the benefits of these exercises, did I start exploring all the different levels of planks and side planks. The plank poses that we'll be going through do require a couple of key components, and because we want our patients and our clients to succeed, and we want them to reach that success as quickly as possible, it's important that we look at these key components as early as possible. And so let's look at the components that we will be bringing up: the breathing from the diaphragm, the activation of the abdominals and pelvic floor musculature, and then optimizing posture. Those key areas are foundational and need to be integrated into the planks and side planks. The screencast will wrap up with two more areas, looking briefly at the additional assessment areas that should be covered prior to exploring planks and side planks. And lastly, how do we look at continuing to progress our clients and not encouraging any regression? So here we go. The key breath in the use of the pose comes from the diaphragm, and the relationship between breathing and exercise has been studied extensively. And with a lot of the lifters, the breath from the diaphragm is really critical. And so in stabilization, I've also found that it's critical. How will you know if someone's breathing with their diaphragm? Well, generally, you will see an expansion of the abdominal wall. And so one way of having individuals become aware of it themselves is having them, whether it's in a sitting position or a standing position or a supine position, even laying on their side, having them rest one hand on the abdominal wall below the rib cage and above the belly button, and the hand should rise and fall, so it should but with the inhalation the hand will rise, and on exhalation the hand will relax back down. The other area for diaphragmatic breathing that is often neglected is the rise and lowering of the lower rib cage. And you should have a simultaneous expansion of the lower ribs as the diaphragm allows the inhalation to occur. And this actually becomes really important when integrating abdominal control at the same time. Some of the cues for health and fitness professionals that you might find helpful is, first of all, speaking as though you're really, truly wanting your clients to relax. Ask them to just really relax. And with a deep diaphragmatic breath, that rise in the abdominal wall will happen in the lower ribs and a slight chest wall rise. When working on the core, as I mentioned earlier, many individuals find the coordination of the diaphragmatic breath and the co-contraction of the abdominals challenging. So to reduce that challenge, which is something that's often done in Pilates, the focus is more on the breath into the lower ribs rather than the abdominal area. It's still a diaphragmatic breath. Secondly, we want to ensure that our clients are able to activate their abdominal wall and their pelvic floor musculature. It's most often integrated or coordinated with the exhalation phase for individuals who are having a hard time activating the abdominal wall and the pelvic floor. So asking a client to start again with that relaxed diaphragmatic breath. And some of the tips that were covered in Paul Hodge's course was to just slowly, gently tighten your pelvic floor. Another cue when looking at integrating the abdominal musculature is after the pelvic floor is integrated, to have your clients think about slowly, gently drawing the front of the pelvic bones together. You should not be seeing any pelvic tilt. The goal is to tighten the abdominals with your back in a neutral position. Positioning and cueing for clients that might be helpful are to, if they're having a hard time, especially in supine, since supine position is often seen as the position where everybody's done their crunches, obviously, so it's so closely affiliated with or in the body-mind integration is more with rectus abdominis, so to explore obliques and transversus abdominis in a supine position can be really challenging. So putting individuals in alternative positions that encourage a gravity-facilitated stretch, such as hands and knees, even in side lying, is often helpful. And you can palpate just in front of the ASIS, the anterior, inferior, superior iliac spine, if you're just placing your fingers lengthwise down towards the groin, and the clients can palpate on the opposite side so that they can actually start to feel when they tighten both the pelvic floor. You'll get a forward facilitation of the transversus abdominis, and then a further tightening of the transversus abdominis where they'll feel more muscular contraction under the fingers. And so that awareness and that positive empowerment that they have control over the tightening of the abdominal wall is really great. Again, encouraging a neutral spine and best postural alignment when exploring the activation of the abdominal wall and pelvic floor is going to assist that happening. So let's go through again some verbal cues that you can use. Breathe in, let it go, slowly, gently tighten your lower tummy. For women, you might actually ask them to first draw in their pelvic floor. So breathe in, let it go, and slowly, gently draw in your pelvic floor. For your male clients, breathe in, let it go, and slowly, gently draw up your scrotum. Once the pelvic floor and the transversus abdominis are engaged, have your clients tighten the entire abdominal area. And one cue that tends to work well for me with my clients is if I ask them to prepare for an incoming punch. Or you can also, ask them to tighten their biceps, show them that they have control to tighten a muscle isometrically and transfer that same control to the abdominal area. So just being able to tighten the abdominal wall, and that's the tightening that we need that should start to happen automatically through the planks and the side plank positioning poses. Good. Next is posture. good posture does start from the feet in all the poses and the side planks, that are done from the feet. And so it's important that the weight is evenly distributed through the ball of the foot, with the weight on the base of the big toe and the fifth toes on each foot. And so if we look over here in the photograph, is someone who is putting far too much weight on the outside, on the base of the fifth metatarsal, and so that's going to make a significant alteration in their alignment up through their entire pose. And alternatively, I often see, especially women, putting too much weight on the base of the first toe, and so it just really feeds into the hallux valgus position of the great toe. And so even though in our mind we're wanting optimum alignment and posture, for many of my female clients, if I tell them that they'll have this added advantage of reducing the hallux valgus if they could focus on spreading their toes and getting the big toe in alignment with the first metatarsal, that's usually a bigger buy-in for them, and I get the added benefit of having them have better alignment through the ankle and knee, and then all the way through their pose. Optimizing posture goes then up from the feet to the knees and the hip joints that should be kept soft or in an unlocked position. Then the lumbar spine in a neutral position, the tightening of the abdominals as we talked about, lengthening of the space between the pelvis and the lower ribs, the gentle tuck of the shoulder blades down and back, and then the drawing of the crown of the head in the opposite direction from the tailbone. And so even if they're in a horizontal plank position, they could be thinking of drawing the tailbone in the opposite direction where it's trying to reach to the wall beyond them. And that's really helpful in optimizing posture. It is not imperative that someone has ideal, perfect posture before starting a plank and side plank, but it is very important that you do not guide them through a plank and side plank that makes their posture worse, and having them be aware of the fact that they're working on optimizing their best posture is really critical and an important part of success through this plank and side plank. So other assessment areas that need to be looked at, as we talked about, is the postural control against gravity. So their ability to control their best posture. If you have a plank position that is 45 degrees, that's going to impose a lot more gravity than a plank position that's at a 60 degree, where the neck extensors and thoracic spine have to work, much harder. So that's an additional assessment area for you. The side flexors play an important role in keeping the head in a neutral position when someone is in a side plank position. The shoulder stabilizers really come to surface in terms of their strength when you start doing single arm 45 and 90 degree side planks. And then the hip stabilizers when you start to go into a single leg plank or side plank, as well as the ankle and foot stabilizers. You can have someone who's looking really powerful in a plank, and you're thinking, oh, this person, in order to challenge them just a little bit, you'll have them, lift one leg. And if you haven't done a full assessment on that individual and you have them lift one leg, and they might totally break down as soon as they lift a leg, you'll know that the leg that's left behind, their supporting leg, that there's a significant issue of stabilization, whether it be at the ankle or usually at the hip. And so that's another way, if you haven't been able to do a full assessment, to get a functional assessment of that person's movement patterns and areas of weakness. And lastly, in this section, I'd like to discuss how we continue to progress individuals without regression. And the three most common things that I see when planks and side planks are improperly prescribed, I'll mention them and then go into them in a little bit more discussion, but discouragement and abandonment, undue discomfort, pain and possibly strain, and then the engagement of the wrong muscles. And so this is not where I want any of my clients to be, or any of your clients to be, which is one of my big motivations for writing this book. But many people who have first attempted to do a pose that was too advanced for them can become really discouraged, and it may cause them to prematurely abandon their pursuit of a strength training program. So the assessment is really essential before embarking on a program that involves a plank or side plank. And the most frequent problems I've seen with the planks and side plank exercises or poses is that they've been inappropriately prescribed by trainers, and in many cases no assessments were done at all. The second point, the undue discomfort and pain, and I've had individuals who've been going through rehab for years, and then their therapists discharge them, and they say, "Oh, you should be okay to go to a yoga class, or you should be okay to embark on a community exercise class." And then the instructor knows little about their medical history because it's a community class or it's a general yoga class, and they're being encouraged to hold the plank position for 2 minutes. And then this person has a total flare-up of their pain. Well, this really immobilizes somebody, from further progression or from further pursuit of a life of fitness. And so it's so imperative that we, walk somebody through not just the poses and the side poses in an incremental fashion, but also in the timing of their poses, in how long each pose is held, and that we looking at always strengthening the weakest link and not allowing them to progress until all those weak links are taken into account, and making them as a whole individual as strong as possible. And then lastly, in the common effects that I see from improperly prescribed planks and side planks is the engagement of the wrong muscles. And this can be a really frustrating area. At least for me, I find it very frustrating when individuals have been, working on planks and side planks sometimes for years, but they've been doing them with, really poor form and engaging the wrong musculature, and they're in an exaggerated thoracic kyphosis with a forward head posture, and to have them back up and bring them into what they consider lower level planks and side planks can be very challenging, and is a harder job for us as professionals than teaching them to do it properly from the get-go. And so for all the future therapists and trainers that will be working with your clients and your patients, do them a favor and teach your own clients and patients to progress safely and methodically through the planks and side planks in the manner that you'll learn through the remainder of this course. So I hope that all your clients progress successfully, and that you, as a trainer, find the information of value. So that wraps up this section of the chapter. In order to keep the screencasts of shorter duration, we've broken the chapter up into 2, and so the next screencast will cover the progression from A to E.